If you suffer from chronic nightmares, the exhaustion is constant. These dreams function as a self-perpetuating learned sleep disorder. This learned insomnia fragments your sleep, drains your daytime energy, and conditions you to fear your own bedtime. There is a solution that avoids the need to unpack painful trauma memories. Imagery Rehearsal Therapy, or IRT, focuses entirely on retraining your brain's imagery system. Because your brain learned this nightmare pattern over time, you can use your natural imagery capacity to unlearn it. IRT is a Level A evidence-based medical treatment supported by dozens of randomized controlled trials. Roughly 70% of patients experience a clinically meaningful drop in how often they have nightmares, alongside measurable improvements in overall sleep quality. These results are stable. Data across 6 to 12 months shows nightmare frequency remains low, and daytime PTSD symptoms continue to decrease. When compared directly to pharmacological treatments like prazosin, IRT achieves similar symptom relief without the need for medication. By following a precise 6-step protocol, you can replicate these clinical results and take back your nights. Step 1 is understanding the goal. You do not need to address every single nightmare. Changing just one or two often has a ripple effect that improves the whole system. Step 2 is an imagery warm-up. Pause this video and take 1 minute to visualize a neutral scenario, like rearranging the furniture in a familiar room. If your mind goes blank, or if negative images intrude, do not force it. Simply acknowledge the image, let it pass, and gently try again. Successfully picturing that room confirms that your innate capacity for imagery is ready for therapy. Step 3 is target selection. Select a single nightmare to focus your work on. It is critical to start small. Do not pick a highly distressing trauma memory for your first attempt. Choose a mild to moderate bad dream to practice the technique safely. Step 4 is exposure. Take a notebook and write down a brief description of the nightmare you selected. If writing causes anxiety to spike, stop at the scary part. You can move to the next step. Step 5 is rescripting. Here, you adopt the role of a movie mogul, the director and screenwriter of your dream. You have the freedom to change the script in any way. You can alter the ending, add positive imagery, or transform threats into harmless objects. Look at this example. On the left, a script of a frightening pursuit dissolves. On the right, it is rewritten so the pursuer turns out to be a friend returning a lost item. Once you have your new concept, write down this entirely new, detailed script in your notebook. By physically rewriting the nightmare, you create a new narrative that serves as the foundation for your daily rehearsal. Step 6 is rehearsal. Spend 5 to 15 minutes visualizing the new dream while awake, finding a quiet space right before you go to sleep. As you read your new script, engage your senses. Notice the sights, sounds, and physical sensations of the positive environment. There is one rule for this step that is non-negotiable. You must never rehearse or dwell on the original nightmare. Only visualize the newly re-scripted positive version. This repetitive rehearsal is the mechanism that displaces the unwanted nightmare content with your new script. It takes a few weeks of daily practice to see results. You might notice a brief spike in your awareness of nightmares when you first begin, before the frequency steadily drops. To accurately measure this drop, you will use specific sleep and nightmare diaries to log your nights. Your daily homework is straightforward. Every night, read your changed version script prior to sleep and fill out your monitoring sheets each morning. After 6 weeks of this routine, you are no longer required to maintain the nightly rehearsal process, though you can choose to continue if it helps you relax. Bring your completed logs to your next clinical appointment so you can review the data with your provider. Through dedicated re-scripting, daily rehearsal, and accurate tracking, you now possess the tools required to unlearn your nightmares and reclaim your sleep.